Regarding the gram negative bacteria, we have the first bacteria to discuss is the Neisseria class. So we have up till now we have known that Neisseria class is belong to gram negative bacteria, and also it's a Diplococcus gram negative bacteria, and it is aerobic. And so Neisseria family, there is first the general rules regarding the Neisseria family. So Neisseria is a gram-negative Diplococcus, and it also has it's a gram-negative. It means that it has the endotoxin, and the endotoxin related to Neisseria is lipo-oligosaccharide, and this oligosaccharide we have known that it binds to toll-like receptor of macrophages and releases a lot of cytokines to induce sepsis and shock. So this is the endotoxin. Then it is the family Neisseria belongs to IgA proteases, and this proteases is very much important because it dissolve the hinge region of the IgA immunoglobulin. That's why it evade immune response. And next the Neisseria family also is it's an Neisseria family also causing a problem when the person is asplenia. When the person is asplenic, then there is strep pneumo, Haemophilus influenza, and Neisseria meningitis, which can cause diseases in the asplenic person. So Neisseria is an aerobes. It can causes Neisseria meningitis and Neisseria gonorrhea. So regarding the meningitis, how this meningitis happen? So meningitis happens whenever there is a respiratory droplet infection because it spread via respiratory or oral secretion. It goes into the nasopharynx, and in the nasopharynx it get colonized over there, and after colonization it goes from the endothelial cells of the nasopharynx and endocytosed into the bloodstream. And we have known that it has a polysaccharide capsule, and this capsule helps Neisseria to evade immune response. So this polysaccharide capsule evade the immune response in the nasal area. It goes into the bloodstream. In the bloodstream, it inhibit complement and macrophages, and in this way it evades the immune response. And after evasion from this immune response, it goes directly into the choroid plexus, and in the choroid plexus it goes into the macrophages of the CNS, and there activate the macrophages via their toll-like receptors, and the macrophages release a lot of cytokines due to their endotoxin. So the sepsis is because of the lipo-oligosaccharide, and the evasion is all because of IgA proteases and polysaccharide capsule. So these are two or three are very much important mechanism of how Neisseria goes, how Neisseria causes meningitis. So Neisseria meningitis. So majority patients are asymptomatic. They are just the carriers, but the minority, some cases, they causes meningitis. So in meningitis there is nuchal rigidity, irritability, and a lot of these kind of symptoms. Then we do CSF examination, and in CSF examination we have bacterial type of CSF findings, and we diagnose the person as meningitis. So the meningitis, Neisseria meningitis or meningococcal, is maltase acid producing bacteria. It is maltase positive, and also this meningitis causing bacteria we give rifampin of the rifamycin family to the close contact for post exposure chemoprophylaxis. We also use ciprofloxacin, but ciprofloxacin has some side effects. So rifamycin is very much rifampin is very much is very most frequently used because it has a good tissue penetration. So we give rifampin and also ciprofloxacin, ceftriaxone as a chemoprophylaxis for the close contact patient. So Maltase positive has polysaccharide capsule. We can also give vaccine, which is also a recombinant vaccine, and this vaccine is very much common for the patient which are at high risk patients. So in the respiratory oral, there is a especially the dormitories of the student universities hostel, and also there is army barracks where this it can spread from respiratory tract. And also this is a things regarding the meningitis section. It is also causes petechial hemorrhages on the skin and trunk and extremities. It also causes water Fredrickson Waterhouse Fredrickson syndrome. And what is this? This is actually the high fever along with adrenal insufficiency, and this adrenal insufficiency can be seen as a bilateral adrenal necrosis, hemorrhagic necrosis. And also we have the DIC, shock and death. So DIC means we can see the schistocytes, fragmentation of the RBCs. We can see thrombocytopenia, and all the DIC related problems which we will discuss later on. So DIC and also shock, because LOS, shock causing cytokines. So we will see this kind of presentation in the patient infected from Neisseria meningococcal. We can culture, and also we do PCR for diagnosis, but clinical presentation is very much sufficient in order to diagnose a patient with Neisseria meningitis. So the treatment is for Neisseria family we always use ceftriaxone, because ceftriaxone cross blood-brain barrier. It is third generation cephalosporin and its penetration is very much good. That's why we use ceftriaxone. And also along with cef we use penicillin G. So this is the general information regarding the Neisseria family, and especially the Neisseria meningitis. Next we have the Neisseria gonorrhea. And what is gonorrhea? It is a triad in which there is a polyarthritis, multiple joint pain, and also there is a rash, vesicular rash, and also there is a tenosynovitis, tendons and synovial tissues inflammation. Also in gonorrhea it is spread via sexual intercourse and also via the perinatal transmission. It also causes septic arthritis, and also it causes pelvic inflammatory disease, and Fitzhugh syndrome also causes conjunctivitis, especially in the children. Presenting with the perinatal conjunctivitis, neonatal conjunctivitis. We also give ceftriaxone, as we know, and also we give azithromycin or doxycycline for gonorrhea. So the most important thing regarding gonorrhea and the gonorrhea is on microscopy, or it can diagnosed via NAT, and on microscopy, light microscope, we see intracellular gonorrhea in the neutrophils. So on microscopy we see neutrophils, and in the neutrophils we have the gonorrhea, Diplococci, Neisseria. So this is all about Neisseria family, how they actually causing meningitis, and also all other symptoms and other presentation. So the most commonly tested scenarios regarding Neisseria is the meningitis section. So gonorrhea is a little less commonly tested question, but the meningitis is very much tested, very much common, and how the route of transmission, how it causes a asplenic patient as a part of Shine bacteria, and also AGA proteases, LOS, which factor causes shock, which factor causes immune evasion, which is maltase positive, why rifampin is used, and also how DIC is related to this. So this is all about the Neisseria, important highlights of the Neisseria family.